Hi, I'm Dr. Gia Croce. I'm here at the Working Dog Center, and we're going to show you some of the things we do on the husbandry team. Basically, we get the pups early so they're not scared or anxious with any veterinary-related experience or skills related to husbandry. I have a volunteer with me, Melanie. She's going to do some of the animal restraining, and rewarding and praise is a very huge part of overcoming some of those anxieties that dogs or cats or any other animal will gravitate towards when they have a trip to the vet if there's anything hurtful that may occur to them or undesirable. So we're trying to overcome that here with a lot of positive reinforcement. Our volunteers come in and they come from a variety of backgrounds, and we have a little husbandry team skill list that we try to go over and incorporate and do on a daily and weekly basis. My role is basically to perform some physical exams and instruct the volunteers and demonstrate, so then they too can come in and do a lot of those skills and help the pups be supported with learning that, you know, some of those undesirable tasks are actually a lot of fun because they're rewarded and they're getting a lot of playtime and love the whole time. So some of the things we do is learn about proper animal restraint, which we generally have two basic animal restraints. If the pup is going to have a skill that's a little more tedious, we try to always kind of have them in a box and make them feel secure. We'll try to kind of give them a hug, going under their belly and under their chin and kind of holding them to us, nice and secure. For things that are a little less traumatic or less involved, we can just do a little collar hold or a little hand under the chin to have them look up and still kind of holding sort of like a box position to make them feel secure. So this is Jake. He's one of the newest pups, newest additions here, and he's doing fabulous. He's not scared. He's very comfortable. I'm just going to introduce some of those positive rewards to him while I go through just a basic physical exam and do some skills. So Melanie, I will have you. You're such a good boy. Here, good boy, Jake. Jake is a good boy. He's a good boy. So I'm going to just check his ears. I'm going to look down his ears. They look nice and clean. So we're just going to go from head to tail for you, little pup. He's doing great. So I'm going to keep going. I'm going to go look at your eyes. I'm just kind of going to look at your eyes here. They don't have any discharge, no weepiness. They look clear. Hi, little guy. He's doing great. I'm going to just lift his gum and look at his teeth and his mouth and touch that to feel if it's hydrated and moist. He's doing great. So we're just going to keep going. He's a good boy. He's such a good boy. Jake is a good boy. I'm going to listen to your heart. Good boy. He's a good boy. Good boy. Ideally, we like to have another volunteer doing the praising and rewarding while somebody's just monitoring, making sure they're not jumping off the table and that they're comfortable. He's a good boy. And then we also have the volunteers listen, and they do all these skills as well and practice and feel comfortable. I'm just feeling your belly now, good guy. He's a good boy. He's such a good boy. He's a good boy. We pick up their paws and we play with their paws. We massage them. Good boy. Get them used to having their feet touched. Good boy. Good boy. Another thing we do is we introduce letting them see the nail clippers. Good boy. And we can even touch them to their paws. Good boy, Jake. He's a good boy. Good boy. What a good boy. I see, little guy. We'll even take a little tip off for him. Good boy. You're doing great.
Look at you.
He is such a good boy. He's doing fantastic. I have a little poultry-flavored toothpaste. Initially, when we start having dogs brushing their teeth, doing any oral care, I just usually put a little of that on my finger and slide along their gums and rub his teeth and gums. And it's a flavor he likes, so it's kind of fun and yummy. Good boy. Then as he gets a little bigger, we'll introduce a little on the toothbrush and do a little brushing that way. He is a good boy. boy. Let's see what else we have for you. Good boy. And then, little man, we do your temperature, which is always, it's always the least desirable, but I'll try to make it very quick for you. And generally, just to prepare him, we're just going to kind of touch this to his hiney area there. That's it. Your little rear end. And he did great. He's doing real great. I tried just to kind of hold on to the base of their tail. And I'm just going to try to insert a little bit, see how he does. Good boy. All done. That's it. Good boy. That's it. Good boy. He's a good boy. You get a little hot dog for that, because that's the worst. That's the worst. Good boy. And we just got you used to a little brushing. What are you doing? Where's your peanut butter? Where's your little peanut butter? Are you out? Are you out? You need a little more? You silly goose. Here you go, good boy. Oh, he's a good boy. There you go. Did I not give you enough, Melanie?
That's okay.
I'll get you more. So then we just brush them too. Good boy. So we just try to do all these little things that kind of makes them a little more comfortable for a vet experience, or anytime they may be out in the field working, they may have an injury, they may need medical care. And we also do some stuff with bathing. We kind of put them in the tub, just start off with a little water around their paws, and we treat them when the water's on so that they get used to having that be a positive, and then we'll turn the water off and we'll stop the treat so they kind of get used to that being fun as well. Those are most of the things we do here, getting their heart rate, respiratory rate, looking at their pulses. This little puppy is also of ideal body condition. We kind of feel for their ribs. We shouldn't be able to see them, but behind their forelimbs, we just kind of put a few fingers and we can feel these little ribs in here. And he's doing real well. He's a good boy. I think that's really a lot of the skills that we do here. And then one of the volunteer vets, we have terrific volunteer vets that come almost every day between the hours of 3 and 5, but anytime they can come, we appreciate that. And they just kind of sign off on whatever volunteer is here. If they've demonstrated a skill, then they can come and do it on their own with any of the dogs. They're learning those skills and techniques to help them feel comfortable. We also wear these white coats as veterinarians and volunteers alike, just so that we get the dogs away from the white coat syndrome. Oftentimes, if they see a white coat, they associate it with a visit to the vet, and they may feel they've had a scary visit. So we do try to get them accustomed to the white coat. We also, as part of husbandry, are very good about measuring their proper nutrition. Each dog gets a little plastic container, and there is a little feeding adjustment chart according to their weight and age. So each dog is listed on this chart, their date of birth, and the amount of cups that they have and how many times per day. So we come to this food container here, and then they each have their own. This is Ronnie. Jake is in the container, in the tub there, getting ready to get rinsed. And we just put the amount of cups, and we keep it in their, they have little plastic carts, if you will, on top of each kennel that each pup resides in. So any medication, any food, these containers are in there. Their leashes, they have their own individual supplies. Some dogs also require blood tests from time to time, and that's something that the husbandry team will do. We'll pull blood. That'll be sent over to the hospital for evaluation. And the other thing that we do is give vaccinations, and there is a calendar on our wall by our exam table that lists the months and the days in that month, and each dog, whatever pup receives a vaccination that day, we're able to go ahead and give that, whether it be distemper, rabies, or so forth. We also provide them with monthly preventatives, frontline, recommended against fleas and ticks, and HeartGuard, which is a heartworm preventative, and we use those year-round, and they're given each month, usually around the first of each month.